We'd like to apologize for everybody who was attending our Stage 3 webinar that we held on 10/22. There was an issue right at the beginning of the question and answer period where the GoToWebinar was terminated and it disconnected everybody. So what we're doing now is we do have all of the questions. We are going to go through and answer every question, and then we're going to post this to the CliniSync YouTube channel, and we'll make that link available to everybody who's attendance at the webinar. So again, we apologize for the inconvenience. We are now going to start into the questions. When they say 4 CQMs must be submitted electronically in 2016, do they mean the VTE1, the VTE2, and so on, or do they mean the VTE group, the stroke group, and the ED group?
Now, I believe it's them each individually, so you could do all 4 VTEs, but we will get clarification on that and follow through on that, but that is my understanding, that they're all separate.
How does the requirement to have an API affect HIPAA responsibility on the part of the hospitals and the EPs? Now, you will have to include your APIs in your security review. The EHR vendor does have some requirements laid out in the 2015 certification rule as to what the security requirements are for the API. So you definitely want to include it. You want to say what you are doing as a provider or a hospital to protect that API. What technical things do you have in place and whatnot. But there is some responsibility back to the EHR vendor.
Okay, and I know someone had written in and asked about this being a final proposal as opposed to still asking for comments. And, honestly, everything that we saw were final proposals, even for Stage 3. Those were finalized, that was finalized language. We were not sure. We tracked back through where CMS was asking or said in the introduction that they were asking for comments, and we could not find them. I believe that the comments that they were requesting really probably only had to do with quality reporting in subsequent years. But again, if we can find any place where they're asking for comments, we will let you know. But please assume that the Stage 3 is a final, what we covered were final regs.
What if my provider does not prescribe controlled substances?
You're not required to do controlled substances or to go through the identity proofing if you're a provider who did not. If in fact CMS decides to require that in the future and it's not part of your provider's scope of practice, there is no obligation to go through the procedure or to make sure that your vendor is certified to do e-prescribing of controlled substances.
And there is language that kind of applies to this and as other measures. If you are a provider who does not order medications or does not order radiology studies, then that is not functionality then that you have to purchase and you have to have in place. You only have to have in place what qualifies for your scope of practice and meaningful use.
As permissible, as prescriptions.
All right, next question. CMS just released an FAQ number 12985 in response to inquiries about the public health reporting objective in 2015. In the FAQ, CMS clarifies that alternative exclusions to the measure in the public health reporting objective are available for providers in 2015 based on the changes to the public health reporting objective. Providers for whom the alternative exclusion is applicable will be presented that option in the attestation system. So just keep that in mind, that CMS is actively updating FAQs. Keep an eye on that FAQ site. Keep an eye on the CMS and ONC mailing lists. Next question. Must the drug and drug allergy rule be enabled the entire reporting period? And the answer is yes. It must be enabled for the entire reporting period. There is an exclusion for providers that write less than 100 prescriptions. It's generally a setting in the background in your configuration. It's easy enough just to go in there, make sure it's enabled, leave it enabled. Next question.
Are we going to develop a crosswalk of the measures from modified Stage 2 to Stage 3? The answer is yes.
Yeah, we will be creating a crosswalk. We're going to be doing some tip sheets. Probably going to do a yearly focused tip sheet because the rules do change a little bit from year to year going forward.